Welcome back to Calyx Cafe. Today I'm interviewing Craig Mooney, VP of Science and E-Tech Enabled Services, and we're going to talk IRT and site data ownership. I can't wait for this interview, so let's get going. Hi everyone and welcome back to Calyx Cafe. Today I am joined by Craig Mooney, who is Calyx's VP of Science and E-Tech Enabled Services. Hi Craig, how are you today?
Doing terrific, Sylvain. Thank you for asking.
So I saw that you have your Calyx mug with you. What's your drink of choice?
I'm good old-fashioned regular American coffee with a couple of Splenda, a little bit of milk. I'm a simple man when it comes to my hot drinks.
Well, simple is not bad, so it's good. So, do you have any particular ritual when you prepare your coffee, or anything specific you like about it?
Yeah, well, I used to not drink coffee really until about 2 years ago. But now I have a very specific ritual where I usually get up very early. I go for about a 2 to 3 mile walk. And then after I finish, then I start to make my coffee as I prepare. And I usually keep it in a Yeti mug that comes with me into the shower. So coffee is joining me throughout my morning until I get to my desk, and then I get another cup.
So, why don't you tell our audience how you got into the industry and clinical trials?
Well, when I was in college, actually, I had the opportunity to do some work in the summers for one of the very first CROs in the industry, GH Bessler Associates, and I just really fell in love with clinical trials and what that was all about and how it served. And when I graduated, I got the opportunity to get a job in the industry. And then I eventually found myself into the IRT space in about 97, 98. And that I really enjoyed a lot. And it was something I developed a skill for and an enjoyment of and understanding of the technology. So that's my story as it relates to clinical research. Started about, like I said, in college, like very early 90s. And then finally my first job in the industry, a full-time job.
Wow, so IRT in 97, 98, so you must have seen so many changes over the years.
Oh yeah, oh yeah. At first it was phone, voice only, and then I had the opportunity. I watched things like the first configurable system, a company that I worked for. We created an internal tool for us to do configuration, which was pretty exciting stuff. Then of course the internet, which really kind of blew it up. But yeah, I mean, I was there in the days where we used to have to send out what we called tone dialers, which were little boxes to replicate the sounds of the telephone in touch tone, because some of the countries we were working in still had rotary telephones. So that's sort of the depth of the experience that I have, starting from, sort of rotary phones to now where every single site has web-enabled technology. It's pretty incredible.
Yes, and I'm glad for the new technology actually. It sounds much less of a hassle. So there's a topic that we've discussed a bit in the past, but I wanted to talk a bit more about with you today, and it's site data ownership. Do you have any experience, anything you want to share on that topic with us?
Yeah, it's funny. I think that this is a bit of a mind shift, or a change in the landscape that I've seen probably in the last 2 or 3 years. And this really came out of an inspection that happened at my last employer with the MHRA. And they were starting to make suggestions or ask for things that I had never heard of before in the IRT space. Things like, wanting to make sure that the sponsor was not as integrated into the data change process as was typical. Meaning, typically, you'll see a lot of organizations want to, or sponsors insert themselves into the process where a site will request a data change and the sponsor will have to approve that data change. And that was just sort of typical practice. Obviously, there's some data changes that should never be made, such as changing a randomization date or time. But other typical changes were even being reviewed by sponsors and approved, and sort of had a feedback loop. And in our inspection and some of the discussions with the agencies, they were really saying that's the investigators' data. They're responsible for determining whether or not that data is valid or not, and not the sponsors. That also sort of manifested itself in the concept of what happens at the end of a study. Now, typically in the ECRF space, an investigator would get, probably still this, like a CD, right, of all of their data from the ECRF, or even in sort of a eCOA or ePro environment, same thing. The investigator would get, all their data. That wasn't something that was happening in the IRT space. And I remember having the conversation with the regulators and talking about that, and them, sort of communicating, well, it's really the same thing. And so when I was bringing that to my business partners, the response was pretty much universally, well, Craig, this really isn't an IoT thing. It's not something that is expected. And sort of my communication back to my business partner was, but it's coming. It's a change in mindset. And you can expect to start to see this request from other sponsors as this sort of becomes a little bit more widely known.
Okay, so that's a change in data ownership then for the site data, if I understand you well. How much of a, I want to say, headache is it for a sponsor to change a process like this, like you explained, where they used to approve the data changes, but now they don't anymore?
Yeah, well, I think in my circumstance, it was, first of all, when you have the impact of a regulatory inspection, you can always point to that and say, listen, this is not something that I myself, Craig Mooney, have decided is the best practice. It's what we're hearing from a regulator. And that always motivates an organization to say, okay, well, if that's the prevailing perspective, then that's something that we should be doing. Now, how difficult is it? Well, in fact, when it comes to sort of the approval process in sort of data changes, that was actually not that difficult. It was really about a change in understanding and working with the vendor partners to say, this is what this process should look more like. We're going to change sort of the workflow. That wasn't so difficult. That was more of just a change in attitude and a change in understanding. When it came to the end of study data, where we are delivering that study back to the investigator, including all of the data changes and audit trails around those data changes, who made the change, when they made it, that was more difficult, mostly because sponsors, many rely on vendor partners for their IRT services. There are some that have some in-house processes as well, and they're going to have to take a look at this as in the same light. So I think the challenge for sponsors right now is to be able to understand that this isn't just their change, it's a change for the industry, and trying to figure out how they can fit into supporting that. As an example, at the last organization I was at, I would say to my vendor partners, please don't just solve this for my organization. You have to help solve it for the industry. And that means working with individual sponsors to sort of work out also, well, what does delivery look like? How do we get this data to the sites? So I think that part, the sort of end of study data delivery, that's where sponsors really are going to have to be more involved in working through the logistics, identifying what data to go, the audit trails, and to be frank, as you and I have talked about, Savant, this is ripe for sort of some industry discussion. That way, people aren't just running off and maybe doing their own thing. So I think it will require a lot of sponsor participation, but also recognizing that this is not just an ask for their particular organization, but a kind of a change in the landscape in IRT data.
Yeah, that's very interesting, and I agree with you that it's something that we should look at across any sponsor, any vendor, and have like a solution that fits, if not all the requirements, most of the requirements, so that we don't have to reinvent the wheel when a sponsor changes vendor, or vice versa when a vendor works for a different sponsor. I fully agree with you. So we've talked about the sponsor side of this new recommendation. How about the sites? How do you think sites will respond to that?
Well, so if I'm being honest, I'm pretty transparent that in some ways this looks like a responsibility that sites aren't particularly asking for. Meaning, I think that this is also a change in understanding of what IRT data is for sites as well. So I think at this point, most people have seen IRT as a transactional process. Now I'm going to put this data in so that I can get out this drug container, or this IMP material, or such that I can randomize the patient and get a treatment assignment for the patient. I think what sites are now recognizing is that the care and the duty and the data management process that they have put forth for their ECRF is now going to have to be sort of translated into the IRT space as well. I honestly don't know, when these, let's say in the old world or the previous world, when, the ECRF CDs would arrive, I don't know if they got put in a drawer. I don't know if anyone ever actually looked at that data or went through to say, hey, I want to do a thorough review. So in some regards, I think the changes will be about sites looking at IRT data a little differently. Also getting used to maybe not having to use that sort of sponsor approval process, but also what they will do with this data when they receive it is something that, to be honest, I'm not 100% clear yet of how they're going to respond. And it also sort of requires a certain amount of infrastructure or process on their side if they don't have it yet. I mean, they should, since they're getting ECRF data in this sort of very similar way. So in some ways, it might not be too much of a burden at all, since they should already have a process for it for ECRF data. It just might mean recalibrating their mind around what IRT data is versus what it may have looked like in the past.
Yeah, so it's interesting because you mentioned like changing culture for the sponsors, and in a way it's a similar change in culture for sites. But what I'm hearing is that there's probably a good opportunity to engage with sites to understand how they see this change happening for them as well in the process.
Yeah, I would also like to add, Sylvain, so we're sort of at a pivot point now around technology, right? How do people want to get this data, right? When I engaged my business partners, when I worked at a sponsor, part of my point is I don't want it. I don't want it coming to my organization. This is something I'm relying on my vendor partner to be able to deliver this data. And I think that was really something that regulators also said, as it relates to data integrity, we don't want to see this data coming to a sponsor and then going to the site. It should go from the repository directly to the site, not sort of into the sponsor's care. But also, we're at a point now where should this be hosted? Should this data, instead of, honestly, I've not had a laptop or a desktop with a CD drive in it probably in 5 years. I'm not even sure if you can buy one. And thumb drives they're not particularly safe. So there are things like, how are we going to maybe host this data for sites? So I think those sort of delivery questions, and this is also true, I think, in the eCRF space too. So I don't think this is necessarily just an IRT data problem, but I think we're at a point where we really have to think about modern data sharing processes.
Yeah, I agree with you. Right, I'm sorry, but I think that's all we've got time for today, unfortunately. However, as people who are watching us regularly know, I like to ask a bit of a tricky question at the end. So is there anything in IRT landscape or in the clinical trials industry in general that you'd like to see in the future?
I think I'd like to see a little bit more understanding. It's sort of related to what we talked about. I think we need to do a little bit more understanding on data and data integrity, but also on sort of on the flip side around sort of one of the things that you and I have talked a little bit about, our direct to patient and what that looks like. And so I'm interested to see how IRT can be more site friendly, how we can really understand that that our primary customer is the site, and try to do as much engagement as possible. I think we're going to continue to see more integrations with IRT. I think we're going to see more opportunities to engage with other business partners in IRT, people who want our data, people who want to contribute to the IRT process with their data. So I see probably more integration going forward in the future, and more sophisticated integration, instead of just saying, oh, we're going to send you this CSV file or something like that. I see something a little bit more sophisticated. There's so much data out there, and I think now's the time to be able to figure out how to move it more seamlessly across platforms and partners for the efficiency of clinical trials. So that's what I'm really looking for.
And that's a very nice challenge to have. So yeah, that's a good one. Right, Craig, it's always a pleasure talking to you. So thank you very much for joining us here at Calyx Cafe. And for everyone who's been listening, again, thank you for joining. As you can tell, both Craig and I are very passionate about IRT. But we'll see you again soon for another great interview at Calyx Cafe. Thank you.